Welcome back to the end of day 2 of this week, which would be, I guess, day 17. This morning we had an OMM lecture, which is osteopathic manipulative medicine. We went over some soft tissue techniques for releasing muscle tension in the cervical and thoracic and lumbar of the back and neck, and some things with the occipital shelf as well. Kind of nice. Had a quiz in there, pretty simple quiz, which is nice to get some free points here and there. Not necessarily free, but if you listen to lecture, it's not hard to get the answers. After that, we had a lecture on glycolysis and the pentose phosphate pathway. Nice thing is those pathways are pretty simple, and we don't have to memorize a lot of structures in this class, which is nice. I mean, you do have to just plow through it because it's a lot of your biochems and things. Not a lot of clinical relevance, more just getting the big picture of what's going on in the body for when you start learning drug interactions and you start looking at other things that are going on with diseases. You know, proteins that are incorrectly folding or non-existent, or mutations, whatever. So that's the nice big picture of it. But this afternoon was really nice because we had our OMM lab, which we go into a lab setting where we practice the techniques we learned in the morning, working on muscles and in the neck, back, upper and lower back, which is really nice to just kind of get out of class and do some things with our hands and feel like you're getting some I don't know, just it's nice to be out of class, to be honest. And then we had clin med today, which is clinical medicine, where we go in and we learn a lot of the things that will go into a physical. This week we did the pulmonary system, where we listened to breathing sounds, different techniques of how to feel for lesions in the lungs, breathing, asthma, normal, abnormal, things like that. Had a quick quiz in there, which wasn't too bad either. And then just learned a couple case studies in that class as well, as far as people coming in with symptoms A, B, and C, asking us for a differential. It's kind of nice to actually feel like you're getting somewhere where you're dealing with some sort of patient interaction, even though we're not dealing with patients, but these are things that are going to help us to help patients, diagnose patients, things like that. After class, we have a powder puff football game that we do every year, where we put the first years up against the second years. So a bunch of the guys got together with a bunch of the girls in the class. We went out through the football, kind of ran through some drills, things like that, which is kind of fun. The guys are obviously up for cheerleading, as the girls will be playing in the football game. And today I got dubbed head cheerleader, which should be a lot of fun. That means I guess I get to come up with cheers of some sort. I don't know. Apparently being somewhat loud kind of got me the nomination for it. And so that should be a good time. Other than that, just went and had dinner with some classmates after that, and then came home, did some study, had a study group for a bit. Overall pretty productive as far as study session goes today. Some days haven't been super productive, but today was good. And that's pretty much it. Now it's about 12:30. I'm about to head to bed. So more class tomorrow, and we'll see you right back here tomorrow night.